think in the DESTINY-Breast09 trial, it was a little more than a third of the patients that had a dose reduction. So we can feel comfortable telling our patients this, about a third of the patients in the trial had a dose reduction and they still had that significant efficacy. So I think if you dose reduce based on your patient's symptoms, you should feel quite comfortable with that.
Yeah, and I think that's something doctors should realize. And I've certainly seen in my practice in terms of the fatigue, it often does respond to that dose reduction sometimes. So definitely something important to put out there. And also so patients don't feel disappointed if they have to lower dose, because patients want to, of course, get the best treatment they can. So, well, let's move on and talk a little bit about pneumonitis. What did we see with pneumonitis on DB09? Mild, how do you manage that? Let's talk about that.
Yeah, we saw about 12% of patients, which is very consistent with what we've seen from all of the Destiny breast trials. So about 12% incidence. The most common grade is 2. And, we have to remember when we're talking about pneumonitis that 2 means mild symptoms.